Okay, good afternoon. It's sun's gone in and it's a wee bit colder now than it was earlier. Excuse the pinging, but Facebook does that. Okay, so the live now is to do with depression and COVID. Now, ONS, the Office for National Statistics, released a document that goes into relative detail from last year about depression and its increases. Now, we'll be looking away from the camera every now and again to quote the various stats. And from July 2019 to June 2020, it was an increase of, well, it was double the figures. The figures for June had increased to 1 in 5 adults suffering from depression, and that was during COVID last year. Now, as I said, that's double the figures that it was before the pandemic. 1 in 8 adults developed moderate to severe depression symptoms during the pandemic, whilst a further 6.2% continued to experience various levels of depression. Feeling stressed or anxious was one of the most common feelings that adults experienced during the pandemic with some form of depression, where they felt that their well-being was being compromised. And that affected 84% of those who were in the health screening questionnaire. Now, what we've got to remember is, hi Kaza, is that mental health affects everybody in some form or another at some point in their lives. Many people can cope with it and are able to have outlets and releases. However, when we entered this COVID pandemic and had 3 lockdowns forced on us, those who already suffering from depression were cut from their lifelines. Many would be able to meet up in groups with others, discuss their feelings, any suicidal thoughts, things like that, and that was all stopped. And the impact of that has been felt massively across not just the UK but across the world, and it's shocking that figures have doubled, and this was till June last year. So the actual figures now aren't available because, and you've got to remember, when the ONS, the Office of National Statistics, does its health screening questionnaire, it only does a certain percentage. So it gives them a guide as to mental health and what's going on. You've got to remember that many people won't be included in that health screening questionnaire, and so it's just a small percentage. The true impacts of COVID and its impacts on people's mental health is only just now starting to be felt and seen, and we need to start looking at these figures and the impact that mental health is having on people, families, friends, communities, and also the impact it's having on charities, organisations, and those healthcare professionals who are out there trying to help those with mental health issues. Now, whilst we've all been put into lockdown, it's fair to say that there's been no proper infrastructure or support put in place for not just people suffering from mental health issues, but those organisations, charities and mental health workers who are out there on the front line trying to help. And as I said, the increase is drastic. Postnatal Depression, PANDA, the charity organisation, has stated that they've had a 240% increase in calls to their hotline from men and women who are suffering from postnatal depression. And child abuse has increased. Now, in May last year, a peer-reviewed BMJ article was released where it stated that in 1 month alone, they had seen a 1,400% increase in child abuse into hospitals. Now, all of these are mental health issues in various forms, and it's frightening that through the pandemic, none of this is being addressed properly. It's not being dealt with efficiently. The governments, the Scottish government, the English government, are not putting anything in place to deal with mental health crisis that is currently happening. And that mental health crisis is going to get a lot worse over the coming months, couple of years. And we need to start questioning our governments, our MSPs, our MPs, and asking what they're doing to help the organisations and the people out there that are trying to deal with everybody who is suffering from mental health problems. Our mental health has a direct impact on our physical health, and it's something that can't be ignored anymore. It's something that has to be dealt with. For example, the depression is known to affect the age group 16 to 39 more than any other age group, and that has increased. And let me just go into the figures here. Okay, hold on a minute. So around 1 in 3, that's 31%, between 16 to 39-year-olds experienced moderate to severe depressive symptoms during the COVID-19 pandemic, so from March to June 2020. And that's compared with 1 in 9, which is 10.9% before the pandemic. So in the age group 16 to 39-year-olds, before the pandemic, it was 1 in 9 that was suffering some form of depression. And during the pandemic, as up to June 2020, it had increased to 1 in 3. That figure alone should tell you and alert you to the problem that we are facing in the UK and the mental health crisis that's going to get worse. Younger adults, now this is according to the Office of National Statistics, and I'm reading it off the screen here. Younger adults were more likely than any other adults to have experienced an increase in moderate to severe depressive symptoms. Around 1 in 5, 22.8%, developed moderate to severe depressive symptoms during this period, with a further 8.2% continuing to experience this level of depressive symptoms. During this period, 1 in 40, 2.8%, saw improvement in their depressive symptoms. So out of that, only a tiny, 2.8% saw an improvement, whereas during the pandemic from March to June 2020, around 1 in 5 developed moderate to severe depressive symptoms. And it states younger adults are more likely than other adults to have some form of depression during the COVID virus. It also states on the ONS, women were more likely than men to be experiencing some form of depression during the coronavirus pandemic. Figures show that almost a quarter of women, 23.3%, experienced moderate to severe depressive symptoms during this time. This is compared with 1 in 8, 11.9%, before the pandemic. Whichever way you look at it, it's obvious that the pandemic has created more mental health issues than ever before. And we're just seeing the tip of the iceberg. This isn't a case of, oh, it's going to go away. It's not going to go away, because mental health issues have long-term consequences, and there's really nothing that's been done to alleviate what's been going on. All these lockdowns, 3 lockdowns, all the regulations and restrictions that have been put in place, people have been stopped from having their counselling. You know, you can do a counsel, you know, you can counsel someone via Zoom, but it's nowhere near as effective as it is face-to-face. You go in a group and you talk with others that are in the same position as you, face-to-face. That's so much more beneficial than trying to do it via Zoom. Zoom and internet face-to-face like this, it's okay, but it doesn't have anywhere near as much impact as being able to do it face-to-face. Cutting people off from their family and their friends and things like that, that has a direct impact on people's mental health. And the figures that I've just quoted show just how badly it's affecting various people in our communities. And we need funding to be put out there for charities, for organisations, because they're under pressure. Charities and organisations and mental health workers are struggling to cope with the demand for their services. They literally are struggling to cope, and that's going to get worse. We need to start saying, right, what's the government doing? What's the Scottish government doing? What's the English government doing to help these charities, these organisations, these mental health workers who are out there on a daily basis trying to cope with the demand for their services because of lockdown, because of the pandemic, because of what's going on? It needs to be addressed. And for an increase during the pandemic of that magnitude, and that's from until June 2020 last year, that's not, I haven't been able to come up with any figures online yet for the months following to now, but they're certainly going to be worse than those figures I've just quoted. 1 in 5 adults are experiencing some form of depression during COVID-19, and that's double the number that it was before the pandemic. And that's just one of the figures. Then it goes on to the ONS, the Office for National Statistics, goes on to say that the figures for the younger people are even worse. And we can't allow this to continue. We need to start asking questions. We need to start getting media involvement. The media are not paying any attention to any of this. You know, the media are very quick to jump on the stats for COVID-related deaths and testing and all that sort of thing. What they're not quick to jump on are all these frightening, seriously frightening statistics to do with mental health issues. And that's shameful. That, you know, the media, the TV stations, the newspapers, they should all be ashamed of themselves for not tackling this, because it's an epidemic in itself, the mental health crisis that we're facing. And trust me, it's going to get worse. You know, I speak to people about it who are on the ground dealing with it, and they're on off their feet. They have so much going on and they have very little resources to deal with it. And it's getting worse. So as human beings, we need to start pulling together. We need to start demanding answers to these questions, demanding to know why they're putting all this lockdowns and restrictions in place without putting the infrastructure and the funding there for mental health issues and those that are suffering because of a direct impact of these COVID impacts. It's as simple as that. And if we're going to stop the mental health crisis, and it's a major crisis, the likes of which hasn't been seen before, it needs to be dealt with. And I, for one, am going to start becoming very vocal, and I'm going to, as many know, I've put my name forward, and I will be standing as a candidate in the Scottish elections, and I am looking to be elected in. And when I do get in, I will be fighting that corner for mental health and the crisis that the mental health services are facing, because that crisis is going to grow massively over the next few months, coming couple of years. So it's not just people like me that need to be asking these questions. You need to be asking these questions. You need to be demanding answers from your local politicians, from your governments. You need to be asking the media. You need to be on social media asking what people are going to be doing, because mental health is crucial through this pandemic, because this is ongoing. And no matter what side of the fence you fall on with regards to the coronavirus, the fact is that as it stands currently, it's ongoing, and it's going to be ongoing for years from what any of us can see. We can't allow the mental health of our communities and the UK population to suffer, and for this crisis to become so big that it can't be dealt with efficiently. So we need to start asking those questions, and we need to start getting the media to pay attention to what's going on. We need that funding in place. I will start asking these questions. I will start finding out why this is happening. I will find out the stats, because we've only got the stats for the mental health increase from up to June last year. So July, August, September, October, November, December, January, February 2021, there are no stats for currently. But I guarantee that the stats I've just quoted for the pandemic up to June 2020, the stats now will be even worse than that. And that should be frightening for all of us, because going by their figures, up to June 2020, 1 in 5 are suffering some form of mental health depression. If it's 1 in 5 then, that means that every single one of us knows at least one person out of our friends and family who's suffering from depression. Now think about that with your own family and friends. We all know more than 5 people. So we've got more than 5 family members, most of us. And we've certainly got more normally than 5 friends. So you're going to know more than one person who's suffering mentally. And some of those, a lot of people suffer from mental health issues and don't discuss it. A lot of people do not know that somebody has depression, because we keep it well hidden. We don't discuss it. We don't open up to people. And that is frightening. So it's not just a percentage of people. The percentage I've quoted from the ONS website is a small percentage of the population that took the health questionnaire. So now times that by the many millions that live in the UK. So if it's 1 in 5 on a small statistic questionnaire, it's going to be more than that. And to say that the mental health is in crisis is putting it mildly. And something needs to be done. People need to start standing up and demanding answers and demanding funding for the charities and organisations and the mental health workers out there trying to help those people who are mentally suffering from depression, especially since COVID. So think about it. Think about your friends, your family. Who do you know who's depressed, stressed, anxious? And also look at those people who don't talk, who are, who seem confident, strong, smile. You never see them mentioning anything. Sometimes they're the ones that are suffering worse than anybody else, and they're just good at hiding it. So, whilst we do need questions, we do need answers, we do need to get very vocal about mental health issues, we also need to start paying attention to those around us, in our families, in our local friends, and within the community. We need to start looking out and seeing who's suffering and how you can help, even if it's just to say to somebody, are you okay? And when they say, yeah, I'm okay, say to them, now, how are you really? And actually ask that question a second time, because sometimes that second time you ask it, you'll get the proper answer. Okay? And ask on social media. Do your own research about mental health issues since COVID-19. Go on the ONS site, the Office for National Statistics. Look at the research that they've done, and then visualise that small percentage of research they've done and times that by the many millions in the UK. And that will give you some idea as to the crisis that is happening and that is going to get worse. Okay, so we need to start doing something about it, and I will certainly be doing something about it, and I hope you do too.